The World Health Organization has declared the new Mpox virus to be an international threat, and the Ministry of Health has come out to sensitize citizens before the virus arrives on shore. Decisive action and immense preparations are being made by the relevant authorities to ensure that the virus is contained. The medical surveillance officer from the Ministry of Health described the characteristics of the virus.
The Ministry of Health, Wellness and Elderly Affairs is implementing precautionary measures and isolation protocols to protect the health and well-being of all citizens. Mpox primarily spreads through direct contact with an infected individual's skin lesions, bodily fluids, or respiratory secretions. Transmission can also occur via contaminated materials such as clothing, bedding, or towels that have come into contact with the infectious lesions.
Dr. Vermeulen outlined the protocols established to handle possible Mpox patients. She also listed the facilities which will process the samples for verification of the Mpox virus.
During your visit, you will be tested for Mpox using swabs taken from skin lesions. Samples can be processed at the Ezra Long Lab in St. Lucia. All suspected cases of Mpox will be isolated for a period ranging from 2 to 4 weeks. Depending on the severity of symptoms, individuals may be instructed to isolate either at home or in hospital.
Dr. Vermeulen provided solutions which can quicken the recovery and limit the spread of the Mpox virus.
Persons on home isolation should isolate in a well-ventilated room and observe respiratory etiquette such as wearing a mask when interacting with other family members. When in isolation, you should not leave your home. In addition, frequent hand hygiene with soap and water or alcohol-based hand sanitizer should be observed, and skin lesions should be covered with long sleeves.
She provided details on the current standing of the virus and how to manage asymptomatic cases.
Based on WHO guidelines, there is no quarantine of contacts of suspected cases and no need for provision of sick leave to asymptomatic contacts. Close contacts should monitor for symptoms such as fever, rash, headache, and muscle aches for 21 days from the date of exposure. Contacts who remain symptom-free can continue with their routine daily activities and can attend work and school.
The Ministry of Health will continue to ensure that its citizens' safety is catered to in the event of a global viral pandemic. Anyone showing Mpox-related symptoms should visit the nearest health facility for medical attention. Post-exposure vaccination is recommended within the first week of contact with an Mpox case. For the DBS News World, Manasseh Stanislas reporting.